In a world where royal families often seem untouchable and perfect, there comes a rare moment when the carefully constructed walls come down, revealing the human heart beating beneath the crown. December 2024 brought one such moment when Catherine, Princess of Wales, stepped into the spotlight not as a flawless royal figure, but as a woman who had walked through the Valley of Shadows and emerged with a message that would touch millions of lives around the globe. The holiday service at Westminster Abbey was meant to be a traditional celebration, but what unfolded that evening became something far more profound. As cameras captured every moment and the world watched, Catherine stood before the gathered crowd with a vulnerability that had never been seen before from someone in her position. Her words would not just update the public on her health journey, but would become a beacon of hope for countless individuals facing their own battles with illness, fear, and uncertainty. This is the story of how one woman's courage to share her most difficult moments transformed not only her own life but inspired a global conversation about resilience, family, and the power of hope in our darkest hours. The morning of December 6, 2024 began like any other winter day in London, with frost covering the windows of Kensington Palace and the city slowly awakening to another busy day. But inside the palace walls, Catherine, Princess of Wales, was preparing for what would become one of the most significant moments of her royal career. As she stood before her dressing room mirror, adjusting the deep blue coat that had become her signature color, she could hardly have imagined that by evening, her words would be trending across every social media platform and making headlines in newspapers around the world. The past year had been a whirlwind of challenges that tested not only her physical strength, but also her mental resilience. It began in January 2024 when she first noticed the persistent fatigue that wouldn't go away, even after adequate rest. Initially, both Catherine and her medical team attributed it to the demanding schedule of royal duties, charity work, and raising 3 young children. Prince George, Princess Charlotte, and Prince Louis required constant attention. And Catherine had always prided herself on being a hands-on mother despite her royal obligations. However, as weeks turned into months, the symptoms became impossible to ignore. The fatigue was accompanied by unexplained weight loss and a general feeling of unwellness that seemed to permeate every aspect of her daily life. Private conversations with Prince William became filled with concern as they both noticed her declining energy levels. William, who had watched his own mother, Princess Diana, struggle with various health challenges, was particularly attentive to any changes in Catherine's well-being. The decision to seek comprehensive medical evaluation came in early March, following a particularly difficult week where Catherine found herself struggling to complete even basic royal engagements. The medical team at the private clinic was thorough and professional, but the wait for results felt endless. During this period, Catherine made the difficult decision to scale back her public appearances, citing a need to focus on family matters. The royal communications team crafted careful statements that protected her privacy, while acknowledging that adjustments were being made to her schedule. Behind the scenes, Catherine was grappling with fears that she had never experienced before. As someone who had always enjoyed excellent health and maintained an active lifestyle, the uncertainty was particularly challenging. She found herself questioning whether she would be able to continue fulfilling her royal duties with the same energy and dedication that had defined her first decade as a senior working royal. The thought of disappointing the numerous charities and organizations that depended on her patronage weighed heavily on her mind. When the diagnosis finally came in April, it brought both relief and new concerns. The medical team had identified a serious but treatable condition that would require immediate intervention and ongoing management. While the specific details were kept private, those closest to Catherine understood that she was facing a health challenge that would require significant lifestyle changes and a re-evaluation of her priorities. The news was shared first with the immediate royal family, including King Charles III and Queen Camilla, who provided unwavering support and encouragement. Prince William became Catherine's strongest advocate during this period, working closely with palace staff to ensure that her treatment schedule could be accommodated while maintaining the necessary level of privacy. The couple made the conscious decision to be more selective about which engagements Catherine would undertake, prioritizing those that aligned most closely with her personal values and long-term charitable interests. This shift represented a significant change in approach for someone who had previously tried to accommodate every request for her time and presence. The treatment process began in May and continued through the summer months. Catherine approached her health journey with the same methodical determination that had characterized her approach to royal duties. She worked closely with a team of specialists, nutritionists, and wellness experts to develop a comprehensive plan that addressed not only the immediate medical concerns, but also her long-term health and energy management. This holistic approach included modifications to her diet, incorporation of new forms of exercise that were better suited to her condition, and stress management techniques that would help her navigate the unique pressures of royal life. During the treatment months, Catherine discovered aspects of herself that she had never explored before. The forced slowdown gave her opportunities for reflection and introspection that had been impossible during the hectic pace of her previous royal schedule. She began keeping a private journal, documenting not only her physical progress but also her emotional journey through the experience. These writings would later become the foundation for the personal insights she would share during the holiday service. The summer of 2024 proved to be a turning point in Catherine's recovery. While still managing her health condition, she began to feel stronger and more like herself again. However, the experience had fundamentally changed her perspective on what truly mattered in life. Conversations with William often centered on their children and how to raise them with an understanding of both privilege and responsibility. But now these discussions took on deeper meaning, as Catherine reflected on the fragility of health and the importance of cherishing every moment with family. As autumn approached, Catherine felt ready to gradually return to public life, but with important modifications to her approach. Rather than simply resuming her previous schedule, she and her team developed a new framework that would allow her to be more strategic and intentional about her engagements. This meant saying no to some opportunities that previously would have been automatic commitments, and saying yes to others that might have been overlooked, but now seemed more aligned with her evolved sense of purpose. The decision to share her health update publicly was not made lightly. Catherine spent considerable time discussing with William, her parents and trusted advisors, whether and how to address her health journey with the public. The royal family has historically maintained strict privacy around medical matters, but Catherine felt a responsibility to use her platform to help others who might be facing similar challenges. She recognized that her visibility and influence carried both opportunities and obligations to contribute positively to public discourse around health and wellness. Preparation for the holiday service became an opportunity to craft a message that would be both authentic and helpful. Catherine worked with speechwriters but insisted that the final words be entirely her own, drawn from her personal experience and reflections over the past year. She wanted to strike a balance between sharing enough to be meaningful and maintaining appropriate boundaries around her privacy and that of her family. As December 6th approached, Catherine felt a mixture of nervousness and anticipation about sharing her story publicly for the first time. The holiday service had been chosen as the venue because of its traditional focus on hope, renewal, and community support. These themes resonated deeply with Catherine's own journey and the message she hoped to convey to others facing their own challenges. The afternoon of December 6th brought an unusual energy to Westminster Abbey, as preparations for the evening's holiday service reached their final stages. Staff members noticed something different about the Princess of Wales as she arrived for her final rehearsal. There was a quiet confidence in her demeanour that seemed to radiate from within, as if the months of health challenges had not weakened her, but rather strengthened her resolve to make a meaningful impact through her words. Catherine had chosen to wear a midnight blue velvet coat that had been specially tailored for the occasion. The deep colour was intentional, representing both the solemnity of her message and the hope that had sustained her through difficult months. Her jewellery was minimal but meaningful, including a pair of sapphire earrings that had belonged to Princess Diana, serving as a subtle reminder of the legacy of compassion and authenticity that she hoped to continue. As guests began arriving at Westminster Abbey, the anticipation was palpable. The invitation list included representatives from the numerous charities and organisations that Catherine supported, along with healthcare workers, families who had faced similar challenges, and members of the public who had been selected through a special application process. The diversity of attendees reflected Catherine's desire to speak not just to the traditional royal audience, but to everyone who might benefit from hearing about resilience and hope in the face of adversity. Prince William took his seat in the front row, his presence serving as a source of strength and encouragement for Catherine. Their children, Prince George, Princess Charlotte, and Prince Louis, sat beside him, their understanding of the significance of this moment evident in their unusually serious expressions. The past year had been a learning experience for them as well, as they had watched their mother navigate health challenges while continuing to be present and loving despite her own struggles. The service began with traditional hymns and readings, creating an atmosphere of reverence and community. However, everyone present understood that the centerpiece of the evening would be Catherine's personal address. As the moment approached, she felt the familiar flutter of nerves that accompanied any major public speaking engagement. But underneath that nervousness was a deep sense of purpose that had been building throughout her recovery journey. When Catherine stepped up to the podium, the Abbey fell into complete silence. She paused for a moment, looking out at the faces before her, many of which she recognized as belonging to people who had supported her work over the years. Taking a deep breath, she began to speak in a voice that was clear and steady, despite the emotional weight of what she was about to share. Her opening words immediately established a tone of vulnerability and authenticity that was unprecedented for a senior royal family member. She spoke about the past year as a journey of discovery, not just about her health, but about what truly mattered in life. Catherine acknowledged that her position of privilege meant that she had access to the best medical care available, but emphasized that the emotional and mental challenges of facing a health crisis were universal experiences that transcended social and economic boundaries. The audience was captivated as Catherine described the moment when she first realized that something was seriously wrong with her health. She spoke candidly about the fear that had accompanied the unknown, the way that uncertainty had affected not just her but her entire family. Her words painted a picture of a woman who, despite her royal status, had experienced the same worries and anxieties that anyone might face when confronted with a health challenge. What made Catherine's address particularly powerful was her decision to focus not just on the difficulties she had faced, but on the lessons she had learned and the growth she had experienced. She spoke about discovering inner strength she didn't know she possessed, about the importance of asking for help when needed, and about the profound impact that support from family and friends had made throughout her journey. Catherine also used the platform to acknowledge the healthcare workers who had cared for her, recognizing them not just as medical professionals but as compassionate individuals who had provided hope and healing during her most vulnerable moments. This recognition resonated particularly strongly with the healthcare workers in attendance, many of whom had been working under unprecedented pressure in recent years and rarely received such personal acknowledgement from high-profile figures. The princess went on to discuss how her health journey had influenced her perspective on her royal duties and charitable work. She explained that the experience had given her a deeper understanding of the challenges faced by the individuals and families supported by the organizations she championed. This newfound empathy, she said, would inform her approach to her work going forward, making her more effective as an advocate and supporter of important causes. One of the most moving moments of the address came when Catherine spoke directly to others who might be facing similar health challenges. Her words were carefully chosen to provide encouragement without minimizing the real difficulties that such experiences entail. She emphasized that healing is not always linear, that setbacks are part of the process, and that it is possible to find meaning and purpose even in the midst of struggle. The audience was particularly touched when Catherine referenced her children and the conversations she had with them about her health journey. She spoke about the importance of honesty, age-appropriate communication, and how she and William had worked together to help their children understand that sometimes people get sick, but that doesn't mean they stop loving or caring for their families. These insights provided valuable guidance for other parents who might be navigating similar conversations with their own children. As Catherine's address continued, she began to weave together the themes of individual resilience and community support. She spoke about how the experience had reinforced her belief in the power of human connection and mutual care. The holiday service setting provided the perfect backdrop for this message, as she connected her personal journey to the broader themes of hope, renewal, and compassion that define the holiday season. The conclusion of Catherine's address was perhaps the most powerful moment of the entire evening. She looked directly into the cameras, knowing that her words were being broadcast live around the world, and spoke directly to anyone who might be struggling with health challenges, family difficulties, or other life crises. Her message was simple but profound: that darkness is temporary, that support is available, and that it is possible to emerge from difficult experiences with greater wisdom, compassion, and strength. When Catherine stepped down from the podium, the Abbey erupted in sustained applause that seemed to go on forever. Many in the audience were visibly moved, with tears streaming down their faces as they processed the vulnerability and courage they had just witnessed.
Prince William's proud smile was captured by photographers and would later become one of the most widely shared images from the evening.
The remainder of the service took on an even deeper significance as guests reflected on Catherine's words. The final hymn seemed to carry additional meaning, and the closing prayers felt more personal and heartfelt than they might have under different circumstances. As people began to leave the Abbey, conversations buzzed with admiration for Catherine's courage and appreciation for the hope and inspiration she had provided. Social media began lighting up immediately following the service, with viewers from around the world sharing their reactions to Catherine's address. The hashtags related to her speech began trending within minutes, and news outlets started preparing special coverage of what was already being recognized as a watershed moment in royal communication and public discourse about health and resilience. The immediate aftermath of Catherine's address at Westminster Abbey created ripple effects that extended far beyond the walls of the historic venue. Within hours of the service's conclusion, news outlets across the globe were preparing special reports and analysis of what many were already calling a defining moment in modern royal history. The combination of Catherine's vulnerability, eloquence, and genuine emotion had created something unprecedented in royal communication. Social media platforms experienced an extraordinary surge of activity as viewers shared not only their reactions to Catherine's words, but also their own stories of health challenges and recovery. The hashtag related to her speech became the top trending topic worldwide within 2 hours of the broadcast, with millions of posts sharing personal testimonies of struggle and resilience. Mental health organizations reported an immediate increase in visitors to their websites and calls to their support hotlines, as Catherine's message had clearly resonated with people who had been struggling in silence. The response from healthcare professionals was particularly noteworthy. Doctors, nurses, therapists, and other medical workers shared their appreciation for Catherine's acknowledgement of their role in her recovery, but also praised her for addressing the emotional and psychological aspects of health challenges that are often overlooked in public discourse. Several major medical organizations issued statements commending the princess for her courage in sharing her experience and for helping to reduce the stigma often associated with health struggles. International media coverage focused not only on the content of Catherine's address but also on the broader implications for the royal family's approach to public communication. Royal correspondents noted that her willingness to share personal struggles represented a significant departure from traditional royal protocol, which typically maintained strict privacy around personal matters. This shift was seen as evidence of the monarchy's continued evolution and adaptation to contemporary expectations for authenticity and transparency from public figures. Within the charitable sector, Catherine's address had immediate practical implications. Organizations focused on health support, mental wellness, and family services reported significant increases in donations and volunteer applications in the days following the service. The princess's personal testimony had provided these organizations with a powerful advocate whose lived experience lent credibility and urgency to their missions. Several charity leaders credited Catherine's speech with bringing unprecedented attention to issues that had previously struggled to capture public interest. The impact on families dealing with health challenges was perhaps the most profound and lasting effect of Catherine's revelation. Support groups across the country reported that her address had prompted difficult but necessary conversations between parents and children about illness, fear, and resilience. Many families found that Catherine's words provided them with a framework for discussing their own challenges in a way that acknowledged difficulties while maintaining hope for the future. Educational institutions also found value in Catherine's message. Schools and universities began incorporating discussions of her address into health education curricula, using her experience as a case study for teaching young people about the importance of mental health awareness, seeking help when needed, and supporting friends and family members through difficult times. The royal connection provided an accessible entry point for conversations that might otherwise have been challenging to initiate. The response from other members of the royal family was uniformly supportive, though each expressed their pride and admiration in different ways. King Charles III issued a statement praising Catherine's courage and emphasizing the importance of the issues she had raised. Queen Camilla, who had her own experiences with health advocacy, spoke publicly about how Catherine's approach would undoubtedly help countless individuals who were facing similar struggles. Prince William's response was perhaps the most touching, as he shared his perspective as Catherine's partner throughout her health journey. In a rare personal statement, he spoke about watching Catherine navigate her challenges with grace and determination, and expressed his admiration for her decision to use her experience to help others. His words provided insight into the private struggles and triumphs that had occurred within their family over the past year. The international diplomatic community also took notice of Catherine's address, with several ambassadors and foreign dignitaries commenting on the universal nature of her message. Health ministers from various countries referenced her speech in their own public statements, using her example to advocate for increased attention to mental health services and family support programs in their respective nations. As weeks passed following the holiday service, the long-term impact of Catherine's revelation became increasingly apparent. Medical researchers reported increased participation in health studies, particularly those focused on the psychological aspects of illness and recovery. The princess's emphasis on the importance of comprehensive care that addresses both physical and emotional needs had sparked renewed interest in holistic approaches to healthcare. Publishing companies began reaching out to explore the possibility of Catherine expanding her message into book form, recognizing the potential for her insights to reach an even broader audience. While she had not committed to such a project, the overwhelmingly positive response to her address suggested that there was significant public appetite for more detailed exploration of her journey and the lessons she had learned. The holiday service also marked a turning point in Catherine's own approach to her royal duties. In the months following her address, she began incorporating elements of her health journey into her charitable work, visiting hospitals and support centers with a new level of understanding and empathy. Healthcare workers and patients consistently commented on the difference they noticed in her interactions, noting that her personal experience had added depth and authenticity to her advocacy. Children's charities particularly benefited from Catherine's evolved perspective, as her own experience of navigating health challenges while parenting had given her unique insights into the needs of families in crisis. She began championing programs that specifically addressed the impact of parental illness on children. Recognizing this as an often overlooked aspect of family health challenges, the ripple effects extended to Prince George, Princess Charlotte, and Prince Louis as well, as their parents' approach to discussing difficult topics had clearly influenced their own emotional development. Teachers and staff at their school noted increased empathy and maturity in their interactions with classmates who faced various challenges, suggesting that Catherine's openness had created positive changes within her own family as well. Media coverage of the royal family also shifted following Catherine's address, with journalists and commentators adopting more nuanced and respectful approaches to reporting on royal health and personal matters. The princess's demonstration of how to share personal struggles constructively had established a new standard for public discourse about private challenges. As the first anniversary of Catherine's health journey approached, reflection on the holiday service revealed it to be a watershed moment that had influenced not only individual lives, but also broader conversations about health, resilience, and the role of public figures in society. Catherine had successfully transformed what could have been merely a personal struggle into a catalyst for positive change that extended far beyond her own experience. The lasting legacy of that December evening at Westminster Abbey was the demonstration that vulnerability, when shared with purpose and courage, can become a source of strength not only for the individual, but for entire communities. Catherine had shown that it was possible to maintain dignity and privacy while still offering hope and guidance to others facing similar challenges. Her words continued to resonate months later, providing comfort and inspiration to countless individuals who found themselves walking similar paths of uncertainty, treatment, and recovery. The Princess of Wales had entered that holiday service as someone who had survived a health challenge, but she emerged as a voice of hope and resilience whose impact would be felt for years to come. Her willingness to transform personal struggle into public service had created a new model for how public figures might use their platforms to address the universal human experiences of vulnerability, healing, and growth.